welcome back to my channel. I am Dr. Cindy and I want you to go floss yourself. So I am doing fun and educational videos about dentistry. I have been practicing dentistry since 2012 here in Canada, and as the owner of my very own practice here at Horizon Dental, I love finding new ways to brighten lives and create smiles. So make sure to subscribe to my channel and click the notification bell so that you can see my videos every single week. Today I wanted to tell you the truth about dental x-rays. So I do get some clients come to my office and tell me that they would just rather not take x-rays right now. And it's kind of flattering sometimes that you think that I can do my job without being able to see what's really going on. But just to let everybody know, I am not that good of a dentist. So today I wanted to tell you the honest truth about dental x-rays and go over why we take them, why some people don't want us to take them, the truth about radiation, and how we make sure we keep you safe. So why do we take dental x-rays? This is a really great analogy from Whitney, a dental hygienist. Her channel is Teeth Talk Girl. I will try to link to her video in the description below. But basically, would you ask your mechanic to figure out what's wrong with the engine of your car just by looking on the outside without being allowed to check under the hood and see what's really going on in there?
That doesn't make sense.
That's basically the same thing as asking us to try and screen you for bone disease, cysts, infections, cavities, faulty restorations, problems with your jawbone. It's asking us to figure that out just by looking at the outside and not letting us take those really important routine images that we need to see what's going on below the surface. Dental x-rays also help me determine how I can best treat your tooth. It's never a fun experience when someone comes in for what they think is going to be a filling and the cavity is bigger than anticipated, and all of a sudden that's turned into a root canal. So not only are you not mentally prepared for getting a root canal, but you might also not be financially prepared. So these x-rays are really important for me to help determine what the best course of action is, let you know how much it's going to cost, and will help me figure out what kind of alternatives to offer you if possible. So basically, at the end of the day, we take x-rays because we want to help you keep your teeth. Another really common question that I'll see is, how often do people need dental x-rays? And the honest truth is that everybody is very, very different. It depends on you. For example, somebody who has a high risk of cavities, that has enamel lesions or demineralized lesions that are becoming cavities that we need to watch and catch at early stages, we will often ask to have those x-rays updated every 6 months when you come in for your checkup. But people who have a really low incidence of cavities often will go for a year or two without having to take all of those routine images. Certain kinds of dental restorations, like implants for example, also get yearly x-rays to make sure that the bone support is healthy and that the restoration itself isn't damaged. So it honestly just depends on what we need to make sure that we're doing the job right. So why do some patients refuse to have x-rays taken? Sometimes it comes down to cost, which I completely understand, especially if you don't have insurance, you have to watch your budget, and I totally understand that. So it's really important to verify with your insurance company your frequency, so how often they will pay for dental x-rays, and let us know so that we can advise you and give you a quote on what we expect to need at your next visit so there are no surprises. Also, another really good way of looking at it is that a set of x-rays to screen for cavities costs around $30. And if we take that x-ray and we see a cavity there, that $30 could actually be the difference between doing a filling, which might be worth a couple $100, say up to $500 for a really large one, could be the difference between that $500 filling or that $1,200 root canal. So not only have you saved money on this particular procedure, but you've also kept yourself out of pain, which is one of my biggest priorities as a dentist. Okay, so what if taking x-rays makes you feel uncomfortable? You've got a really small mouth or a high gag reflex. Believe me, we get it. We have seen it all. And I totally understand. I have a small mouth myself. The best advice that I can give you, honestly, is to just let us know that you're struggling. We have lots of tricks and different things that we can do to get you through that procedure. or we may be able to offer you a different type of x-ray that's going to work better for you in that instance. So it's definitely important to have that communication with your dentist and your hygienist open at all times. So I think that one of the biggest reasons that people want to refuse dental x-rays is because they're concerned about the amount of radiation. And I think it's really easy to forget that we're actually exposed to a lot of ionizing radiation in our daily lives. And a lot of this concern seems to come from a study that was refuted in 2012 that linked dental x-rays to incidences of brain cancer, which, yeah, if there was proof that our dental x-rays were causing brain cancer, we would stop taking them. So as you can see from this lovely chart here, a single dental x-ray is worth about 0.2 microsieverts of ionizing radiation. A chest x-ray is worth about 100, and an abdominal x-ray is worth 800. So you can see that there's a really vast discrepancy between the two. You can also see that the maximum level of radiation that is considered safe is 50,000 microsieverts per year, which means that if you do the math, you would need to have 250,000 dental x-rays to reach that limit of that safety limit of radiation. I honestly can't imagine an incidence. I would have to take an x-ray. I would have to take like 1,000 x-rays a day on everybody to make that happen. That ain't happening. I also really like this chart because it highlights the fact that our daily dose of radiation from just going for a walk is 10 microsieverts. So that would be the equivalent of 50 dental x-rays, which I can guarantee you I wouldn't take on a single person in a single year. Just because the amount of radiation exposure that you get from dental x-rays is really tiny does not mean that we don't take every safety precaution that we can possibly think of. We will always provide you with a lead apron with a thyroid collar to protect any of those areas that we do not want to expose to radiation. We also use digital x-rays, which have been proven to expose people to 80 to 90% less radiation than the original traditional film x-rays used to. Other major benefits of using digital x-rays is that we get an immediate image. So there's no waiting around for our patients to get the film processed and then see if we got what we needed and then take a new one and repeat that process. So we gain a lot of efficiency with that. They're also digitally stored, so we can't lose them. And we can email them or provide them to other doctors that we're referring to or to your insurance provider. We also protect the environment by not using any more of those toxic chemicals required to develop film. And one last element of safety that I would like to point out is something called the ALARA principle. As low as reasonably achievable. This is a principle that is near and dear to my heart because it dictates that we are going to take the minimum number of images required for me to do my job properly. Some people might need 4 x-rays when they come in for a checkup, depending on how many teeth they have and how big their teeth are. How many can we fit on a single image? If we can fit them all, if you're like me and you have tiny teeth, you are lucky. Do we need to check on the health of that dental implant? Do we need to see if that root canal healed? Are we looking for your wisdom teeth? All of these things will help us determine which films we need, but we're always going to do the bare minimum. Now, to round things off and to jump into a slightly different topic, there is this misconception out there that it's not safe to take x-rays on pregnant women. So contrary to popular belief, there is actually no medical indication not to take x-rays on pregnant women. We're always concerned about exposing a developing fetus to anything that may damage its growth and development. And ionizing radiation is definitely on that list. So we'll often defer any sort of elective procedures on pregnant women until after delivery if possible. But it's incredibly important not to ignore your oral health in that time frame. Pregnant women are at a higher risk for gingivitis and gum disease. And if you end up developing any sort of infection while you're pregnant, that can affect the growth and health of your baby. So it's incredibly important not to ignore a problem with your oral health because you're afraid of a little bit of radiation exposure. And don't forget, if you are pregnant, you and your baby will be protected by that lead apron that I mentioned at all times, so that we will not expose your baby to any of that radiation. And that's it for this video. Thank you so much for watching. I really appreciate it. If you enjoyed this video, please let me know in the comments below, and don't forget to subscribe to my channel and click the notification bell so that you can see my videos every single week. And don't forget to go floss yourself.